On June 21st, a grassroots coalition of doctors known as Urgency of Normal released an open letter to the CDC and the White House asking for a paradigm shift when dealing with kids and COVID. They urge the CDC to stop asymptomatic testing and isolation policies and retire vaccine mandates and restore children to normalcy, much as many other countries have done. Join us now for a panel with several of the doctors from Urgency of Normal talking about why we need this paradigm shift. I mean, I think introducing yourself and talking about what your specialty is and what you're seeing on the ground, and maybe also, I think most, if not everybody here, is a parent. So I think also just relating it to your personal experience. I know, Jen, you're in Canada, and Canada is also different from, region to region. So just even talking a little bit about that and what the need, many people think that we are at normal already. Like, are we not? Like, what's not normal? Where should we go? Why?
Hi, my name is Eliza Holland. I am a pediatric hospitalist, a member of the Urgency of Normal collaboration, and a parent. Along with Dr. Vidal and Dr. Noble, I have written an open letter to Dr. Jha and to Dr. Walensky at the CDC asking them to please remove all the remaining COVID mitigation measures on our children. Although school is out for the summer, the testing, quarantine, and vaccine mandates that are still in place through the CDC continue to have a negative impact upon our children as they go to daycare, summer camps, and it even impacts their ability to work.
Carol, do you want to go next? Talk about how the letter came about and why you have invested so much time and energy in it too.
So my name is Carol Vidal, and I'm a child and adolescent psychiatrist. I'm double certified in psychiatry and in child and adolescent psychiatry, and I also have a background in public health. I have two daughters. They're 11 and 13. They attend public school, and I also happen to do my clinical work in public schools in Baltimore City and in Maryland. And the motivation for this open letter to the CDC is that we have observed as a group that in many different states, we continue to have the age group with the least political capital, which are children and adolescents. And I would argue that also college students, because they're in a delicate situation, have the strictest COVID restrictions that continue to affect them. And we've seen the majority of the population going back to normal in every possible way, but children's education continues to be disrupted, and with testing and isolation policies, and also with requirements of boosters that have very little benefit compared to the risk that we see with the existing data. So part of the problem that we're seeing is that a lot of the institutions that are mandating this or carrying on with these policies are actually following the recommendations of the CDC, and they don't discriminate by age or by risk. And we thought that asking the CDC to change the language would be beneficial for children. And also because the CDC as a government institution, I think their role is to take the most conservative approach, and they have taken an ultra-conservative approach in terms of COVID mitigation strategies. But the institutions that follow the CDC recommendations don't necessarily have to do that. So I think it's important for the CDC to sort of like give space for those differences, depending on risk factors. And also, I think that one of the things that has really struck me about the approach that the CDC has had is that in public health, we always talk about a balance between public health and or the interest of the public and also individual rights. And you always want to have a balance between policies that you make to protect the public and respecting autonomy and individual rights, especially when it's not clear-cut that some practice is going to help with transmission or when you have a very low risk group like children and adolescents for COVID. So I think part of the issue too that we found is that I feel like just like we ignore the devastating effects of school closures, we continue to ignore the ongoing disruption of education and bad outcomes that can lead to. Because right now, if you think about how much disruption kids have had in their school years, if we continue implementing the same type of policies, this will be the fourth school year that a lot of the kids will be having affected by quarantines and by mandates and by just educational disruption in general. And for those who know about the effects of educational disruption, even a few days of missing school can have long-term effects, not just in terms of the lower graduation rates, but also lower unemployment rates and even just general mental health and general health for a lifetime. So I think one of the issues that impact, or at least I see as a concern as a child and adolescent psychiatrist, is that there's actually a true epidemic of school avoidance or school absenteeism since the pandemic. That was a problem already before the pandemic, but it has just gotten worse. And that not just can have consequences for children, but also for society in general, because a lot of the kids that start having school absenteeism end up having really difficult lives, and also it's really hard to get them back to school. So I think in general, the ask is that the CDC needs to be more child-friendly. And I think they understand that COVID risk is stratified by age. We've seen that from the beginning. But also should the practices and the policies that we implement. Maybe it makes sense for a 70-year-old immunocompromised man to wear a mask and boost routinely, but it certainly doesn't make sense to have the same approach with a 10-year-old who's healthy at this point in the pandemic, given that the virulence of the new variants and the level of immunity in the population is completely different from when the pandemic started, and also that the vaccines have not really been modified for new variants.
I'm Allie Krug, and I'm an epidemiologist, and so pleased to be part of the Urgency of Normal. I'm also a parent, and I have 2 teen boys, and my research into vaccine safety and myocarditis specifically was prompted by my concerns as a parent, really wanting to evaluate risks and benefits of vaccines compared to the very low risks that are presented to children by infection with COVID. And now, where we are at this stage of the pandemic, we really feel that the urgency to return to normal is paramount for children. And that's for 3 reasons. We really believe now is the time to restore a common sense approach to practices like should the child go to school or to camp or to play sports based on illness and symptoms, and just remove this blanket testing for asymptomatic children and return to testing as it's meant to be used, which is for treating an infection so that it can inform our treatment. I also think it's time to restore confidence in our immune system and in our body's ability to fight off infection, because we've been well prepared either by recovering from COVID previously or by the wonderful vaccines that offer tremendous protection against serious disease. And the third thing I think that it's time to restore is caution in developing vaccine policy. And I feel that is so important because parents have questions not just about COVID vaccines, but now about all pediatric vaccines. And I've worked for more than 2 decades in preventive health, and I'm very concerned about our confidence in the vaccine program here in the US in general. And I believe it's time for us to restore confidence in the vaccine program by transparency and by removing coercive mandates, which make people feel like they're really being pressured into a decision and eroding the trust that they have in their trusted medical professionals. We really want to give them an opportunity to have a conversation first. So again, common sense, confidence in our immune systems, and also in public health messaging and in our vaccine program, and removing coercive mandates. Thank you.
Question, I may have missed it, but where are you, and how old are your kids, and what's the landscape like?
I am actually a hockey mom. I have 2 teen boys, and it's back to normal here in Virginia Beach. As a matter of fact, the first year of COVID was a very difficult time. We did have very strict protocols in place at our ice hockey rink. And actually, I was one of the researchers who published in the British Journal of Sports Medicine how we did that, how we allowed children to have a normal hockey season while preventing transmission back home among their higher risk parents. But the second year, last year, we went fully back to normal. We dropped all precautions. We allowed people to, practice, as normal, but also if they wanted to take more strict precautions for themselves and their families, we did make that available to them as well. So we had kind of a hybrid approach. But back to normal here in Virginia Beach. The kids are going to school unmasked. There was no increased transmission as the kids were allowed to go to a mask optional stance in February. And really, parents are fine. Many parents are worried. And that's one of the things that I think that the folks here on Urgency of Normal can help address is, questions that parents of young children have. Just, should we be worried about bringing our kids to visit grandparents on Father's Day? What if we want to go inside and, the children have already recovered from COVID, but what precautions should we really take around grandparents who have been vaccinated and boosted twice now? I think it's time to really help parents navigate this time of endemicity with COVID in a common sense approach.
That's great. That's really great. Thank you. Jen, do you want to speak for a few minutes?
My name's Jen Grant. I am an infectious diseases specialist and medical microbiologist in Vancouver, British Columbia. That's about 2.5 hours north of Seattle. I am the mother of 3 children from ages 7 to 13. And our state in British Columbia, thanks very much to the excellent work of my colleagues in public health, is that we are now almost completely back to normal with the removal of the federal travel requirement for vaccine passport. I just really respect my colleagues in public health who have been pushing very much for normality for children, because they were very early on seeing some of the side effects of the abnormal policies that we had adopted. We actually had a few cases, I believe, of starvation in children because they weren't able to access school meals. And those were isolated events, obviously, but it's not something that we want to see in a modern democracy. And in fact, we went back to school in June 2020. What we learned was that it's remarkably safe and remarkably okay, and the kids do much better. And my kids have just been so appreciative of that. And it's been such an important normalizing aspect of their lives. They've continued their skiing, which I think that makes their lives just so much better. I have to empathize with a hockey mom, although as a Canadian, I should be a hockey mom. I'm not. And I signed on to the letter because I think it's so important that we keep a sense of proportionality. Yes, vaccines are good. Yes, vaccines are helpful, especially for those people who are at high risk. But I have to ask the question, if the cost of a vaccine is that a child, for whatever reason, if their family isn't into vaccination, is that they don't go to school and they aren't able to interact in society, compared to the risk of COVID, especially to children, it's just not worth the amount of harm that does. So we really need, no matter what we'd like people to do, we need to keep a sense of balance in terms of whether the punishment fits the crime. And the coercive keeping kids out of school, not allowing them to interact, is clearly more harm than the benefit offered, but even by a great vaccine. So that's sort of why I signed up and signed the letter. And I think we also need to recognize and accept the limitations of the vaccines. They are wonderful at stopping severe disease. They have saved millions of lives. They stop people from going to hospital. But what they don't do is they don't stop transmission. There may be a short period shortly after vaccination where that's the case, but after every variant, we've seen substantial waning. So we really need to be sure that if the expectation is the vaccines will stop transmission, they won't. And that really needs to enter into our considerations for children. Children need to live lives. They need to be healthy. They need to interact with other children. And since the vaccines don't stop transmission, and they do protect high-risk people, especially high-risk adults, we can let children be children even if they're not vaccinated, because the adults around them are protected.
Thank you. I have a question. Did you say that your schools opened in June 2020?
Correct. Yeah. So they started a gradual return to school in June of 2020, and we were full-time in person, at least as an option, in September of 2020. And one of my wonderful colleagues, Alex Choi, followed all of the cases that were seen in children and showed that, in fact, the risk to children in schools is negligible. The other thing we have to remember, and this is a point that I've made again and again, is if we close schools, The only way that's going to actually stop transmission is if children cease to exist, and they don't. So instead of being in the same place all day, every day at school, especially in communities where there may not be as much ability to hire a nanny or whatnot, the children are running from house to house to house to house where people can care for them, often with grandparents who are the highest risk if you're worried about children being a source of infection. So you've actually made things worse by closing schools, just in terms of disease transmission.
That's really interesting. I guess I'm so laser focused on every place, especially New York City, that's done things wrong. How did you guys get it right? Like, what was the mechanism there that reopened schools, and what can we learn from what you guys did?
I guess I really do, as I sort of said before, I really want to thank my colleagues in public health who brought a lens of equity and brought a lens of reasonableness to the response to COVID. They recognized that COVID was a significant threat, and they made, I spent hours and hours and hours on outbreak calls for long-term care and making sure that our elders were protected. But they also recognized the importance of protecting our youth and making sure that the people who are at highest risk for severe outcomes, like our youth at risk, were also considered in the measure. And I think there's a couple of individuals who were instrumental in just keeping that in the public eye and making sure that we were thinking about it.
Great. Well, thank you so much. I really appreciate it. Kristen, I know that you will have to hop off soon. So if you could talk about why you signed the letter and how did you come to feeling so courageous and able to stand up?
My name is Kristen Walsh. I'm just a general academic community pediatrician. So I do teach residents and med students, but I also mostly just see a lot of patients. And I work in a very ethnically diverse and socioeconomically diverse clinic. So I really see all kinds of kids. I see, doctors' kids and nurses' kids and a lot of Medicaid kids. And I work in a really special place for that reason. And it's something I really enjoy, but also I think like some of us here, I've also seen the impact of the restrictions on kids in my catchment areas here in New Jersey this entire time. And I think, as pediatricians, we tend to be cautious as relates to anything medical. And I think we always, are trying to keep kids safe, but I do think that got twisted, unfortunately. And the things that we have been trying to do to keep children safe actually ended up harming them quite a lot. And starting with, closing public schools in major urban areas, I was so upset about that in March 2020 that I wrote a letter to the New York Times, saying, no, you can't indefinitely close New York City public schools. And I think it's because a lot of the kids that I serve, as has been mentioned here, they are dependent entirely on public schools for all the hot meals that they get. They eat breakfast in schools. And one of the things before COVID came along, I was a huge advocate for trying to get breakfast in schools, in public schools. And then, they get their free lunch at public schools. And unfortunately, for some kids who are less lucky, most of the caring adults in their life are to be found at school. So for many reasons, I was really upset about public schools closing, especially with, nobody remembers this, but actually in March 2020, there was actually very sensible CDC guidance around COVID telling schools when they should close. And we ignored it en masse. There was this mass panic. Whole states closed, with no COVID cases basically yet. That included my district, my entire state. There was like an executive order to close schools, and I don't even think my town had any cases of COVID yet. And I feel like that describes a lot of our COVID mitigations, where we sort of panicked, didn't follow any of our pre-existing playbooks, even the ones that, CDC at the time had come up for COVID, and imposed all these sweeping mitigations where nobody really thought about what the harms would be down the road. And unfortunately, what we saw, all of us, I think, is that these mitigations were sort of imposed on a dime. And then it was just like moving loads of cement to get them off again, even when there was nobody in the hospital, even when cases were down. And, here in New Jersey, I think we still have a statewide mandate in all healthcare settings. And I firmly believe that in my outpatient pediatric setting, that mask is doing more harm than good with me and my patients. It's very difficult to connect to my toddler patients or my teenagers who have stuff going on with masks on. And it makes it difficult to follow the rules when they cease to make sense. And, like you said, Natalia, many people think like, oh, it's normal now, but there's this dichotomy, here in Northern New Jersey, where I can tell a lot of my patients aren't very concerned about COVID. A lot of the times when I walk in the exam room, they are like surreptitiously quickly putting their mask back on because they know that's the rules, but they clearly weren't concerned enough about it to keep them on when I wasn't in the room. And just, walking around in the community, people are not nearly as concerned. And, in my department, most of our kids in the hospital for respiratory viruses for many months now, it's been other respiratory viruses, not particularly COVID. We've seen a lot of enterovirus. We've seen a lot of rhinovirus. And my colleagues understand that these are the respiratory viruses that are putting kids in the hospital right now. It's not COVID, but there's still this COVID exceptionalism with like the crazy quarantines from childcare, and nobody can keep track of the rules. Did you have a positive contact? And it does get surreal when the actual morbidity we're seeing in children is mostly from other respiratory viruses, but all the crazy rules are still for COVID, and they just don't seem to move, and they don't seem to adhere to common sense anymore in many ways. And they really are impeding children. I am losing count of the children that have abnormal social skills because, for example, in their kindergarten year, they weren't allowed to play with other kids. There was no recess. I'm not exaggerating. Like, this is how things were around here. And I have parents who will tell me, I understand Joey has delayed social skills. I think it's because his kindergarten year was so messed up. Or, I know that Susie isn't talking very well. She, we were afraid to send her to childcare like we did all her other siblings. And so I hear these stories all the time. And I think it's really time to take a hard look at our mitigations as they relate to children. And, as others have stated, our immunity for kids, our natural immunity and vaccine immunity is really high, probably upwards of 80%. And that is a real thing. And I think we need to acknowledge that, especially when we're considering excluding kids from school and camp and sports based on vaccine status, or these childcare quarantines where like some contact had COVID and now you have to be out for 10 days, even though you're perfectly healthy. I really think it's time to revisit a lot of these policies and make them sort of make sense and align to, where our kids' lives and immunity levels actually are now.
Thank you so much. And I guess one other thing is, personally, and you have twin boys, teenagers, and I just wanted to get a temperature for where you think teens are at, because in New York City, we really have hyper-focused on the little kids, which are very, very important. And they're finally, most toddlers have mask choice. But how are the teenagers doing?
Yeah, what I see in my patients, and, my friends and I talk about this, sort of the degree of anxiety and mental health levels has been through the roof. And, obviously, I think, as many have said, kids were dealing with mental health issues before. Teenagers were before, absolutely. But I think most of us on the ground treating teenagers during like the really prolonged mitigations and the prolonged mask mandates, for example, we saw everything really get exponentially worse. And I think almost everybody had the same experience I did, which is, I had friends call me to say that their child really wasn't doing well. I had so many confidential conversations with my friends. They know I'm a pediatrician. They were trying to get me to help them figure out if they could get through the night without going to the emergency room. And, my own, on a more personal note, my own son lost a friend to suicide. And, I think the people who knew that child were concerned that, it seemed pretty clearly like a lockdown related suicide. And so I think that we also have to take these things into consideration. It really annoys me when people act like it's nothing for teens to not see their peers' faces for years on end. Like, this will be no big deal. And I think it really was a big deal. And it's amazing. Like, I'm sure many of you have seen it with your own children, but a mask is like, oh, no big deal. They don't mind, until masks become optional in high school. And then nobody's wearing them anymore because the kids want to see their friends' faces and they just want to be kids. And, I think as we've been reiterating, that it seems very clear that can be done quite safely.
Great, thank you.
Yeah,
Hi, Mario.
this is what. Hi, really proud and honored to be here. I am a general pediatrician and a pediatric hospitalist, and I'm a double board certified in pediatric and pediatric hospital medicine. I'm a senior pediatric hospitalist in the largest children's hospital in Florida, although, you know, we all represent ourselves here and know the institutions that we work for. And I have been working since the beginning of the pandemic with the National Multicenter Research Group, sponsored by the Children's Hospital Association. We have published 2 papers on the impact of COVID-19 on respiratory illnesses and on severity of illness of hospitalized children with data from the FEAST database. And we have the 3rd paper coming in pediatrics. It was the pre-printed version, came this week, and it's going to be published in September. So I've been very active in academic activities, teaching residents, designing the pathways for the testing and management of COVID in the emergency room and in the hospital and in the ICU. And I have been involved as well in healthcare research related to COVID-19 and impact on operation and respiratory illnesses in Children's Hospital in the United States. I'm going to try to summarize a few thoughts. First of all, I'm signing the letter of urgency of normal because we are not in a normal state for kids yet. The COVID-19 may be at the tail, but the consequences for young children and adolescents of 2 years of restrictions are still showing up, and they will be showing up for a little while. So it's extremely important, the role of this group in urging everybody to go back to normal as soon as possible. Epidemiologically, we may be at the tail of the pandemic, case count, hospitalization, etc. But there is a lot of impact. There is a great impact on all these mitigation strategies on the children's mental health. So I remember since the beginning of the pandemic, we were all curious. And the very first report showed that, you know, thank God that this didn't affect children the same that adults. And there was a very asymmetrical stratification of mortality in different brackets of ages, with most of the patients dying in the early or the older groups, and a very small impact in children. It doesn't mean we don't think that there are children affected or dying for COVID or MISC. I was checking today the numbers, and we have probably between 1,100 to 1,400 deaths from COVID in children. So it's a real situation with COVID. But when we go to the case fatality rate and infection fatality rate, we realize since the very beginning, since the Wuhan report and the early reports in Europe, that this disease disproportionately affects adults and somehow spare the kids from severe disease and mortality. So then further publications early in the pandemic showed that the secondary transmission at school was very, very minimal. And the expert and scholar from UK started to pinpoint that we should be careful with extending a blanket set of mitigation that will impact the whole population and impact disproportionately children. And as the pandemic keep moving, we keep seeing that our country, unfortunately, didn't follow those advice, didn't follow the science in general. And we were actually imposing all those restrictions to everybody in the general population and in children. So we are seeing now the impact of that. And I just want to, emphasize what everybody have been seeing here about the need of eliminating the testing for asymptomatic children and the quarantine, and moving into the testing to treat, as we do with any other respiratory illnesses. Testing just for the sake of testing and a case count is just pretty much a low-value service and waste, as we describe in pediatrics. We need to test to treat and stop testing asymptomatic children and quarantine. We have to restore the confidence in the healthcare system with a clear message. And we emphasize the fact that we need to go to normal with this real-time story that I'm going to tell you. I recently have been in West Palm Beach, for example, in South Florida, to a ballet performance at the Travis Center, and even more recently, I visited Chicago, trying to, to revamp our normal life of traveling and vacations and so on. And the Netherlands Theater in Chicago for a musical. And it's very sad to see that the majority of the people that are masked are teenagers. Pack of teenagers masked with the rest of the population is not masked. So I think there have been a significant fear imposed into teenagers and young children, and there have been a disproportionate implementation of mitigation strategies in children that are really affecting them more than the general population. So based on that, based on the fact that have been mentioned already here of the mixed immunity and the natural immunity, I went through the same that Alison Kruger. I think I beat you, Alison. I got COVID in June of 2020 with my 85 years mom also having COVID, and it was a very challenging week for us. We did very well, both of us. And then I get my 2 vaccines, but I keep wondering, I didn't get any boosters because I said I have my natural immunity in my respiratory system, as Karen mentioned, or one of the colleagues here, and I have 2 vaccines. So this is another fact that for some strange reason, science have been ignoring. And we have been ignoring the fact that the natural immunity is what God designed to protect us from respiratory viruses. In the Miami area, as you know, a very multicultural place, and in the state of Florida, that fortunately our local government, I was capable to see that, thank God, our local government adopted more like a Scandinavian kind of policies. The school were ordered to open early in the August of 2020. And even though the local government and the state government have been vilified, I was checking today the statistics of case fatality rate according to the AAP and the CHA state aggregated reports. And since the pandemic, the mortality in children, the case fatality rate is 0.01%, which is exactly the same that the national case fatality rate of 0.01%. That has been the case fatality rate reported by 46 states. So even though our state have liberal policies in terms of masking, avoiding mandates, and early opening of the schools, we have at the end similar results in the rest of the states. That tells you that all those other restrictions that have been imposed elsewhere are really unnecessary. So there are so many factors that made me join this group. I met many of you through the pandemic, through Twitter, and I follow some of you guys with never knowing that I'm going to be in this group. I'm proud of being here, and I'm proud of signing the letter of urgency of normal, because I think we are not in a normal state for kids, and it's important that a grassroots group like this work together from all over the country and try to provide at least some wisdom and some light at the end of the tunnel, and a vision for the children to go back to normal.
So great to have that information, talking to people who are, in places like where Jen is and where you are, where things actually didn't go so wrong, so that we can learn, what to do versus just what not to do. So thank you for sharing that.
My name is Dr. Todd Porter. I am a community pediatrician. I am also the parent of 3, youngish kids. I have an 8, 10, and 12-year-old. So my 8-year-old, who's going into 3rd grade, has never yet experienced a normal school year due to the COVID response. And I mean, I think to kind of get a picture of why, I signed on to the open letter for a paradigm shift for the CDC. I think it's important to kind of see how we got here. We are dealing with this ineffective response, and enter the second academic year affected, the 2020-21, and my children and my patients had to then deal with these asymptomatic healthy quarantines, which continued to persist. So we have this mounting evidence, usually presented to us internationally, because our own public health system really wasn't doing these quality studies. And then we also were imposing these non-pharmacological interventions, which we kind of thrust on our children without any evidence of the potential harms that they may have. And I think that's as a parent as well, for me, that was one of the hardest things to understand and accept is just kind of our public health lack of acknowledgement of risk benefit and first do no harm. And so I had to send my children to, and again, my kindergartner, then first grader, for 8 hours a day when they were able to go to school, in a mask that we didn't have really any clear data was protecting them or others. And then one of the, at the time in December of 2020, one of the most probably methodologically well done studies that the CDC did, the Georgia school study, this is even pre-vaccination, only showed that adults wearing masks in school and ventilation was statistically significant in reducing transmission, but it did not show that children wearing masks was effective. And instead of, I think, of the science evolving and the public health response evolving, with this, accumulating data, the CDC, the American Academy of Pediatrics, the infectious disease doctors influencing them doubled down on the whole mask wearing. And so here we go through this, this second academic year, really with, in my opinion, using our children as human shields for the purpose of our pandemic response of protecting adults. Basically by cutting out their in-person learning, stopping all their sports, and eliminating all of their social connectiveness, with their school, with their teachers, with their peers. And then you have these reports come out where BMIs have doubled, type 2 diabetes has doubled. And, we're entering this epidemic of, the mental health crisis in our teens with suicidality. And it almost seemed like it was a surprise. And I think that that's kind of the way that both in the CDC and the American Academy of Pediatrics kind of presented it. And as a community pediatrician, and in the 2021 year, I was in Denver, Colorado, at a safety net institution with pretty much all low-income, children of color as my patients, and I just witnessed their weights go up 30 to 50 pounds. And when you basically take all opportunities for activity away from all of our kids, but especially these vulnerable kids, then how can you be surprised that you basically initiate an obesity epidemic because of your response, not because of COVID? And then when you take away all their sports, which for I would say a lot of kids, I look at my kids, sports are your identity in a lot of ways. And for some children, school is not your equalizer in life, but, your activities and your sports can be that equalizer. Sure enough. Even in my own practice, we had an epidemic of children needing to see mental health therapists, children who were suicidal. Most of our public health response was kind of created and executed by people who were sitting in a desk looking at statistics. And so all of my patients were, I think, just a number for them. You know, moving to Illinois just this past year, you know, I see the same unintended consequences, the immeasurable, incalculable harms, not from COVID, but from our public health response. And I'm dealing with chronic absenteeism, and the schools telling me that my patient isn't learning because they've been absent. Well, last year they were absent 59 times, but this year they've already been absent 30. We've changed our children's relationship to school. Tragically, unintentionally, we've taught them that school is not essential. Their education is not essential. And that's what I still see with the CDC guidelines. You know, as someone else I think it says, we are not back to normal for our kids. Their risks are far greater from other respiratory viruses and other health morbidities that they're dealing with, whether it's their mental health, whether it's their physical health with their obesity. And these are things that we need to acknowledge. We need to acknowledge, you know, how we've gotten here, and so we can then basically accept what the risk benefit calculation is, and we need to immediately allow them to return to like pre-pandemic normalcy. I think let them know that their risk is low, and that they should not, you know, be fearful of, you know, re-engaging in these, I mean, what was essentially their childhood that they had before.
Yeah, that's so true. You know, here in New York City, I'm sure that this campaign has been replayed all over the country, but in the subways, we have these ads that tell you whether you're good or bad based on how much interaction you're having. If you're masked and it's over your nose, you're good. If you're looking at your phone, you're great. If you're looking at each other, not so good. If you're talking to each other, very, very bad. So those are the messages that people have gotten for a year and a half, 2 years now. Nikki.
Hi, everybody. I'm Nikki Johnson. I am a board certified in general pediatrics and in pediatric critical care, or that is the intensive care unit medicine. And I practice in Cleveland, Ohio, so large metropolitan city. I have had my head ready to explode this entire pandemic with all of the ways that we have decided to treat children throughout, with a lot of these policies that don't necessarily make sense to me. And the up and down kind of roller coaster that we've been on is just so unhealthy for all of us. So everybody has so far touched so many of the points that I've already wanted to make. So it's kind of hard to say something unique in here, but I signed on to this letter from the CDC that we have written to the CDC because I don't think that we've achieved our initial mission yet, and that is to restore normalcy for children. And I signed on to this to get to that point, that children will understand that it is okay that they live with a virus that is now endemic, that they have, yes, survived and made it through a once in a century pandemic. Yes, there have been some people that we've lost along the way, some friends, some family members, but it is okay that we move on with life and return to normal. Every single thing that we've taught children throughout this pandemic, this last couple of years, has been something that's going to be imprinted on them for the rest of their lives. A lot of the criticism that I've gotten and we've gotten as a team, Urgency of Normal, is that we ignore the consequences of long COVID or those post-infectious diseases, states that you can get from getting COVID. Long COVID is rare, and we really, it seems to be even more rare in children. When people do get it, yes, it can be debilitating, but the symptoms and the signs of it are very variable. And the majority of the time, it's not the physiological state isn't necessarily correlated with what the person is actually feeling or sensing. But that doesn't mean it's a bad, it doesn't mean that I'm downplaying the illness itself, or that it can be debilitating for people. What it does mean is that I'm acknowledging that, but I'm also acknowledging that there are far more, it's far more likely for children and even young adults to actually have long-term effects from our policies and restrictions that we've placed upon them than it is for them to get long COVID. Anxiety, depression, those are lifelong illnesses. They don't just start and then go away one day. You lose a friend to suicide, you become suicidal yourself. That doesn't just go away. You don't erase that. Missing your prom, missing your senior year on a basketball team, and that year that was maybe going to be the year that you got accepted into a college because your grades were mediocre and you thought you could make it on a basketball scholarship. Maybe that dream was shattered because of something that adults decided was in your best interest. So we can spend hours, days, months recording all of the things that have been consequential to children's lives, children's psychology, their academic achievements and lack thereof, their growth and their development. We can spend a long time talking about that. But what we really need to do is get children back as close to normal life as we possibly can. And so this letter to the CDC hopes, I believe, put forth a nice summary of the knowledge that we have about COVID-19 and its effect on children, the knowledge that we have about the vaccines that are available for children and adults, and mitigation strategies that are actually beneficial to help prevent people who are vulnerable to being hospitalized and dying from COVID, those actual mitigations that will actually help those people. And knowing that those mitigations don't have to start with children protecting adults. Todd said it earlier best, children are not human shields for adults. So we know all of these things. We also know that there are viruses like RSV, which I spent the majority of my training and my career helping kids through that illness, supportive care in the ICU while kids are critically ill with RSV or influenza, and the majority of kids not being vaccinated are really significantly ill. That nights, admission after admission of kids getting RSV and influenza in the winter times, putting them on ventilators or high flow nasal cannula, which is a form of assistance for ventilation. Throughout this pandemic, we didn't spend nights in the ICU, and I have to make a disclaimer though. First, I am not I do not practice in the intensive care unit any longer, but I am very much a part of my division of critical care. I do practice more like an anesthesiologist outside of the OR. I don't want people to think that I'm, misappropriating my clinical acumen. But I work very closely with my colleagues and we meet regularly, and I know what's going on in the rest of the hospital. I do take care of kids who have been out, left the ICU, or kids who are in the hospital still, kids who are immune compromised, kids who are medically vulnerable to COVID. So I do have close contacts, and I have worked throughout the pandemic in a hospital setting. So let's just clarify that. But our hospital has not been filled with COVID. Not. What the hospital has been filled with consistently throughout the pandemic is kids filling up psychiatric beds. From the very beginning of the pandemic up until now, there's a shortage of psychiatric inpatient beds for kids. And then granted, those were always in short supply, but we didn't have kids sitting in overcrowding in emergency departments waiting for a psych bed at this degree before. So that is why I'm signing this letter. I would like for us to return to a state where people can have confidence that their public health and their medical professionals are making decisions that are based on actual science, actual knowledge, and actual taking into consideration the actual risk and benefit of any type of measures, treatments, vaccinations, all together, and then consider the entire patient. I've studied my entire career on how to take care of the whole patient and the whole family. And we just dismissed that for the last couple of years, just to try and get to some unattainable goal of having zero viral transmission for one virus, not all of the millions of viruses and other diseases that are out there that we can transmit and spread to one another. I want to have people believe in vaccination again. I think what we've done so much damage to public health in the way of removing confidence in what vaccines are actually capable of, just by the messaging around the COVID vaccines. This is something that's going to impact us for years to come. We're already seeing people who had gotten their children, their primary series of childhood vaccinations, deciding that they want to forgo or delay subsequent vaccinations. And it's all based on this current policy. And then finally, I really want to talk about, kind of deal with that anxiety from not only parents out there of the littlest kids, from anyone out in the public. I mean, Natalia, the story that you tell about this woman getting really afraid of you coughing because you were choking, having a meal, this woman, putting on her mask and running away rather than stopping to see if you were okay, to check on you and to offer assistance. To me, that's just appalling. We have really damaged the psyche of this nation and the world by the way we've responded to this virus. So I want us to be able to sell a message that helps people to understand what the real risk is. I want people to go back and be engaged with their own physicians, their own practitioners, and actually talk about their real risk of getting disease and spreading disease and talk about common sense ways that they can mitigate and live their lives.
Spend so much of your time talking about this and advocating in addition to your crazy day jobs. It's amazing, and I'm so great. We're all so grateful. And you're probably one of the main reasons why we've remained sane throughout all of this and have hope for the future.
So I'm Martha Fulford. I'm an infectious disease physician based in Hamilton, Ontario. And up until the end of March, I was a 100% hospital-based physician, or end of May, I should say, I was a hospital-based physician. I say was because I actually have retired from hospital work as of May 31st. So I spent the pandemic actually as an infectious disease physician working at a women's and children's hospital. So, the vast majority of the work I was doing was with children, obviously, and that's been my work for over 10 years. Before that, I did both adult and pediatric infectious diseases, a mix of both, but the last 10 years, it was pretty much exclusively pediatric. And what we saw very quickly, as others have said, was we weren't seeing children admitted to our hospital with COVID, but we were seeing a lot of what we were terming collateral damage. And by that, I mean misdiagnoses, children not seen for a week because they had a fever and they kept being told to isolate at home. But in fact, they were septic with bacterial infection, so presenting very late. We saw very late diagnoses of cancers, very late diagnoses of inflammatory bowel disease. We saw some very advanced cases of malnutrition. We were seeing the harm and of course the mental health. A really marked increase in eating disorders, a marked increase in anxiety and depression and acting out in overdoses. And it was very clear that while COVID was a very real virus, and it was also very clear that the policies that we need to put in place for seniors who were clearly at quite a higher risk from COVID we didn't need the same policies for children. And in Ontario, where I am, we had some of the longest school closures in all of North America. And it's very hard to understand why that happened and why we seemed incapable of looking at the data from other regions and other parts of the world to see what was working and what wasn't working. And I know obviously there's letters to the CDC, and I'm in Canada, and one could ask why on earth is a Canadian signing on, but we need a consistency in recommendations, and the CDC is, has always been a respected organization in terms of putting out recommendations, and they do influence the policies in Canada. And I think it's important for us to start to have consistent policies and evidence-based policies. We're over 2 years into the situation. We have a very high degree of population immunity. It's a combination of post-infectious immunity, so natural immunity, and vaccine-induced immunity, or what people are calling hybrid immunity. Regardless, the end result is that we have a population in North America with a very, very high degree of immunity. And so we're in a very different position. And our policies now should really be targeted at each individual population or group within our population. And we should have policies that look out to do the least amount of harm to that group. And so with children and youth, they don't need to be isolated. We've isolated them for 2 years, or over 2 years. Social starvation is not healthy for anybody, and it's certainly not healthy for developing children. And so as we move forward, we need to stop and think, do these policies make sense going forward? Maybe they didn't make sense at the very beginning, but rather than looking backwards and arguing about whether or not we needed to do them, it's really, where are we now and how can we move forward? We clearly do not need a lot of the same mitigation measures. We should very absolutely be looking at, regardless of your politics, we should look at what happened in Florida, what happened in Sweden, what happened in Switzerland, in the United Kingdom. What about Spain, where they had some places with high with mitigation measures? We need to look at what worked and what didn't work. And what's very clear, if you look around the world, is that children not at particular risk from COVID at all, and that they actually can go to school with no mitigation measures. They can resume their normal life, and this doesn't actually have any bad outcome. So we will have areas in Canada and areas in the United States where children essentially went back to normal in 2020. And we've had other areas where they have been very, very constrained in what they're allowed to do. And I think we're going to see a really big difference in what we're seeing in those kids as they start to grow up. But if Sweden was able to never, I mean, they kept their schools open right from the very beginning. They never shut down for under 16. They never masked their children. They didn't shut down all those sports and the extracurriculars. We should be able to look at that country without judgment, without casting aspersions on, whether it was lock her down or let her rip or whatever, but just pragmatically and look at what worked. Florida, which I guess is a bit of a, it's a political hotspot depending on where people are in the political spectrum. But can we put our politics aside and say if Florida was able to have all its schools open with minimal mitigation measures and no shutdown of extracurriculars, and the outcome for the children is the same as the average for the United States, that's an important piece of information that people should acknowledge. In Canada, British Columbia was able to keep the schools open for September 2020, and we had huge shutdowns in Ontario. And I worry going forward that if we don't start now advocating for having a return to normal, no more random testing of children, no more irrational quarantines of entirely healthy people. A child who is completely asymptomatic or very mildly symptomatic does not need to be in isolation for 5 or 10 days. This simply doesn't make sense anymore. We need to stop excluding children from activities based on whether or not they've been vaccinated, what stage they're at. And this is particularly important because, as has been pointed out, the vaccines do not stop transmission. So the personal benefit, particularly for those at risk, is very clear, but the public health benefit is not so clear. It's certainly not very clear with children. And so the reason that I signed on to this letter is because I think it's really important that we start talking now before September about where we want to be, and our focus and our policy should be on what do our children need, and taking that step back to what health means. I was always taught that health is a complete state of physical, mental, and social well-being. It's not just the absence of disease. So health is not just no COVID. Health is everything else. It's making sure we look after all the physical needs of our children. Activity is important. We've talked about obesity. Obesity is going to be a lifelong problem for these kids. With obesity, we're going to have problems with early onset diabetes, with hypertension, with cardiac disease. This is setting these kids up to fail for the rest of their lives. And so we need to think now about having policies that look after the health and well-being of our kids, but that holistic health and well-being is just as no COVID. COVID's endemic. It's not going to go away. We've always had 4 circulating coronaviruses. This is going to be number 5. It'll be a seasonal coronavirus, and we need to treat it as such. So we need to think of COVID as we would have the other 4 coronaviruses that a lot of people don't even know circulated all the time. Because if we don't, we're really compromising the future of our children, and the future of our children is the future for us. It's the future of our society. So I mean, that's where I am with this, is advocating very strongly that we need to have policies that look after what our kids need, what our teenagers need, what our young adults need. And those policies are going to be very different than the policies that we might want to keep in place for a high-risk nursing home or for a high-risk unit in a hospital where we've got very immunocompromised patients. But we don't need a one-size-fits-all policy. And so it is time for our big organizations, for the CDC, for Public Health Agency of Canada, to actually take a step back, 2 years into this, acknowledge that we've got a good baseline immunity, look at the outcomes in different parts of the world, and have policies that promote what's best for each member of our society. And what's best is not just no COVID.
Thank you so much. I think this is so great and such good information. And I think nothing beats having a long form conversation. It's like the antidote to Twitter. It's not toxic. It's healing and important. And I think this is how problems get solved